So, Assalamualaikum warahmatullahi wabarakatuh, and a very good day to everyone. As I mentioned, today this one is going to be a synchronous teaching and learning, where this particular lecture is the continuation from my first lecture that I gave. And for this one, I'm going to explain more on, you know, on the misconception about physical activity, and how to for you guys to monitor your clients' physical activity, and how you guys can guide them based on their capability. Okay, you have to keep in mind. We are discussing about promoting and prescribing exercise to special population, those who have high risk of injury based on their health condition. And also in this lecture, I'm also going to introduce you or discuss with you about difference between relative versus absolute intensity of doing a physical activity or exercise based on a different kind of a fitness. Okay. So yeah, what are the misconceptions usually about physical activity that hinder interest among among a special population to do exercise, and take exercise as an alternative way in treating their illness? So there's a certain misconception. Yeah, a possible reason for low level of physical activity in the population, okay, in general, maybe because of the misperception that health benefit can only be achieved by them participating in continuous high intensity or vigorous exercise or sports. So many people didn't realize that actually by performing moderate amount of physical activity can also improve health, okay, not just by doing high intensity. So this perception is belief that they must exceed certain hard level of doing physical activity or exercise in order for them to gain benefit, okay, while actually this is wrong. By doing even low to moderate, as low as 40% or 30% from their maximal intensity, can also improve their health, if not their fitness. It also can improve their health internally. Sometimes we didn't see in their changes in their fitness level. They might see that they're not getting stronger, or they're not getting tougher. But believe me, their health or their internal changes, their internal physiological system may change to something. For example, their insulin tolerance could be improved, or their um, yeah, their happy hormones or endorphin hormones improve, and makes their mental health improve as well. Okay, so that could be one for example. And because of this misconception, okay, by ACSM, which says previously in the initial first phase of recommendation to do physical activity, ACSM did recommend that everyone must do 20 minutes of continuous vigorous exercise for at least three times per week. Okay, and because of this, it sounds discouraging for those who have illness and inability to perform vigorous exercise. They could be, the main reason. And because of that, they revise it back, the guideline, and the current guideline says, the current guideline that has been introduced in year 1995. It is advisable for you guys to perform 30 minutes of moderate physical activity on most days of the week. So they just mentioned in general most days of the week, which is actually more than 4 times a day to produce health benefit. So this is, it is a matter of wording in encouraging people to do physical activity. So based on this revision, it promotes more people, especially for those in special population, to do more exercise. So let's now discuss about the exercise dose. And exercise dose is usually referring to the FITT formula. So I very much believe that you are already aware, or you even know in and out about how to dosage each and each type of your exercise mode or fitness mode in prescribing a training program. So FITT formula is the component of exercise dosage of exercise that you can use in your training program. I'm not going to discuss this further. I believe you know this already. So you can analyze all this dosage, the FITT formula, in every exercise component. In every exercise component. Can use it in aerobic, cardiovascular endurance, muscle strength, muscles endurance, flexibility, what else? Those of intensity, those of exercise or fitness components that you already learn, even if you're on the first year. So the question is, what is the optimal dosage that you can see changes in your physiological system? What is the dose? So there's of course a debate continue up until today. What is the optimal dose required for health to be gained or fitness performance to improve? Where at one end, I would say there's 2 spectrum. At one end of the spectrum is low intensity activity with frequent bouts throughout the day and week, and the other perspective, other spectrum would say higher intensity activity performed in shorter bouts as little as 1 times or 2 per week. So of course this depends on the goal or type of training program that you have set. You have to play around and compensate between these 2 spectrum in order for you to first not to over exercise your clients, and second, motivate your clients, and the third one, to see a minimal changes, because seeing changes, observing changes is also kind of or type of motivation to your clients. So you must play around with that in order for you to sustain and make your training program more effective. So there's no certain optimal dosage. You have to play around, because it more, I would rather say, it's individual factor that makes the optimal dosage difference. So now let's go to physical activity monitoring and guidelines. Before that, I would like to ask you guys, what are the difference between physical activity and also exercise? What are the difference? Okay, you must be able to differentiate these two, because you're third year already. I presume you can differentiate these two. And what can I say? Physical activity is challenging way for you guys to prescribe to your clients, because it's not easy to monitor, it's not easy to get track on. Physical activity is not as structured as an exercise. Okay, when you do exercise, you have a certain guidelines, you have certain aims, certain intensity that you have to achieve, what to do first before next. But physical activity is usually things that more, I would say, leisure, and the things or activity that is commonly or daily being performed by a person. Okay, for example, physical activity can be brisk walking or walking your dog in the park, walk, or brisk walking with your friends. Bringing your window shopping can be physical activity as well. Doing house chores, okay, those are example of physical activities. Fishing as well could be good example of physical activity. So in order for you guys to promote exercise and physical activity to your clients, to your special population, you must make sure that it's fun and enjoyable. It has a component of fun and enjoyable. Then only you can sustain the motivation and improve their interest in doing exercise and doing physical activity, in improving their illness. So yeah, you must embed, okay, their daily or their interest into the sort of training program that you want to prescribe to them, so that they can sustain longer. Okay, so however, as I mentioned, it's difficult for you to guys monitor the physical activity, okay, compared to exercise. But of course, there's a way to do that. And two gold standard in measuring physical activity is W labeled water, or simply acronymized as DLW, and then accelerometer. Okay. However, the disadvantage of these two methods, although it's a gold standard, meaning that it's really reliable and valid method in measuring physical activity, it doesn't really give a physiological, explanation behind. Okay, especially intensity, to monitor what is the percentage. Therefore, usually scientists or exercise practitioner or instructor will use heart rate monitor, okay, in order to monitor their clients' progress. Okay, and the next disadvantage of these two methods, they are expensive. Okay, what is actually doubly labeled water? It's actually by giving a water that has a special characteristic or special isotope. In this case, use 2H218O. Okay, it's a water, but it's a marker, water with marker, and the client or the patient have to drink the water, and then throughout a week or a day, a scientist or the trainer will monitor the output of water and also water plus carbon dioxide that is created from the persons, and from that they will make a graph, okay, to see how quick the isotope water or with the marker water being eliminated from the body. So if the isotope tracer, or marker or output from the isotope water consumed initially, if it makes a steep curve or a steep line, a linear line, steeper linear line, that means the person perform higher exercise or energy output, okay, compared to when higher R naught, lower R naught, which resemble lesser activity being performed, or lesser marker being traced from their urine and from their sweat. Okay, so I hope you understand that. So that's doubly labeled water. So based on the certain isotope markers in the water, and trace the output of excretion from the isotope markers consumed, then it can change, put in the equation and turn it into the amount of activity or amount of calorie being performed. All right. So differential elimination of the LW dose will predict the amount of activity being performed. Okay, the more activity performed, the more you excrete the water that you consume, the isotope water that you consume. Okay, that's the doubly labeled water. And the next one is accelerometer. It's for you to monitor your activity. And apart from accelerometer, there's other devices as well for you to monitor your intensity, which are the oximeter. This oximeter is the device that you usually wear when you're in the hospital to monitor your oxygen concentration. Okay, it's usually monitor in a unit of SpO2. Okay, the how much oxygen dilute in your blood. So oximeter can be used as your device to monitor your oxygen level. And then apart from that, pulse meter or pulse signal is also used to monitor exercise intensity. And nasal respiratory monitor is to monitor oxygen consumption based on exhaled and inhaled oxygen and carbon dioxide. Okay, and heartbeat, body posture, okay, based on certain markers, thoracic respiration. Okay, those are sort of technology that you can attach to your body to monitor your physical activity, can monitor your physical activity and energy output. All right. So, as I mentioned, those devices are quite pricey. Okay, it's expensive. It's not everybody can afford that, and therefore we come out with alternative way to monitor physical activity, which are the physical activity diaries, pedometer. Okay, pedometer is a meter that counts your steps, how many steps you perform. Okay, and then questionnaires. Okay, these are the validated questionnaires that have been designed by WHO or SSM together with SSM. Okay, which are IPAC, which is the International Physical Activity Questionnaire, and GPAC is the Global Physical Activity Questionnaire. And these two questionnaires, I'm not going to explain in detail. I want you guys to look into it deeply because it's available online everywhere. Okay, you can find it and try to understand. And what can I tell is both IPAC and GPAC, they use metabolic equivalent as an indicator to monitor physical activity level. Okay, and I'm going to explain you further about the metabolic equivalent or METs. Okay. maybe some of you guys have already known this, but yeah, never mind. I will explain this later for you to just revise back. And then apart from these two questionnaires, IPAC and GPAC, of course you can create your own questionnaire, okay? But you must make sure that you validate this questionnaire to make it, reliable and valid, okay? But all new methods in monitoring physical activity, okay, no matter questionnaire or a device, anything that you invented, you must validate that against doubly labeled water and any laboratory equipments that can provide estimated energy expenditure. For example, cycle ergometer can tell you how much calorie you consume, how much calorie you burn, those sort of things. And also, you can also use the accelerometer reading for you to validate. Okay. So how to validate a new test, okay, questionnaire? Okay. First, you have to do the reliability test. Okay. Reliability is, a retest result that is will produce a similar reading. You have to do that. Okay, maybe I can just quickly explain to you how you guys can get the reliability of your new measurement, new way of you monitoring. So just copy this image, copy this. What's this? Okay, just ignore this line here. Okay. Okay. Let's say you are designing. You want to design a new. Okay, let's say you want to use a pedometer, and you want to validate the method of putting a pedometer to your clients, and you want to measure how and what is the amount of calorie use at a certain intensity or certain duration when your clients perform steps. Okay, when your client perform a certain number of steps. So yeah, let's say to do the validity test, yeah, you have to perform, you have to draw a graph, and let's say, and how you guys to validate it. Okay, for example, ask your participants to do the walking. Okay, do the walking on let's say a walking treadmill. Okay, and then you classify into certain range of steps. Let's say 1 to 100. Oh, it's too difficult. That's right. Okay, let's say 1 to 100. 1 to 100 steps. Okay, 1 to 100 steps, and then followed by 100 to 101 to 200 steps, and then followed by 201 to 300 steps. Okay, let's say just focus on this 3 first, because after that you can just do extrapolation to predict how many calorie burn at certain range of walking. So yeah, to validate the new methods in monitoring your clients' energy expenditure of your newly invented methods in monitoring their physical activity. Let's say your clients want to do gardening or brisk walking with a friend, or you simply walk the dog, and use that physical activity in your training program to promote his or her health. And then test them on a walking treadmill. Ask the person walk on treadmill, and then monitor the amount of calorie burn. Let's say, okay, this is I don't know. I'm just putting a random number. Kilocalorie. This is what. Let's say just put like 300 calorie. 450, I guess, the calorie. Okay, and then put the pedometer on, and then ask the person to walk on the ergometer, and then monitor the number of calorie. Let's say on the between 1 to 100, person will achieve, I don't know, maybe somewhere here. Okay, kilocalorie, and then 401 to 200, slightly, of course, increase in number of calorie burn. Could be somewhere here, and then 201 to 300, the person will achieve, this somewhere here. Okay, sorry about the misprecise markers here. Okay, since I'm just using mouse to draw the graph. So yeah, so it's just sufficient enough for you guys to just do a perform a 3-stage of number of steps, and then the rest you can just extrapolate it. Okay, if you want to do more, then it's okay. And then draw a graph so you can predict if the persons do 301 to 400 and what is the number of calorie. This is the way that you can test the sorry, this is not reliability. This is not reliability. This is validity. Sorry, yeah, to test the validity. Okay, test the validity of that particular new way of you measuring physical activity level. So, so in a way, you will know that actually this pedometer is the best way for you to monitor your patient energy expenditure. Okay. It is a tool to measure the energy expenditure. It's validly defined. This method can measure. Or if it's not pedometer, maybe you can also use questionnaires. Okay, certain questionnaire scores. Okay, you design your own. Let's say you design your own questionnaire, not IPAC, not GPAC. You design your own questionnaire, and in that particular questionnaire, it has certain scores. Okay, I'm going to get rid of this first. Okay, well, let me just okay, let me erase this first. Okay. Let's say you have certain scores of a certain stage, depending on your questionnaire. Let's say this is questionnaire. Okay. Questionnaire. So yeah. Let's say it scores, 1 to 5, and then followed by, okay, 6 to, I don't know, 10. Oh, 10. Oh, sorry. times everything. Okay, 6 to 10, and then 11 to what? Any number, 20, 15, 15. So that I'm just putting number randomly, and then based on this score, and then the amount of energy expenditure. Okay, you can also draw a graph. It can be not necessarily positively correlated. It could be negatively correlated. Okay, it can be like this, meaning that the higher the score, the lesser they are being the more inactive they be, or the higher the score, be the high amount of physical activity they perform. It depends on type of questionnaire. It can be positive, it can be negative. Okay, and then against that, with any reliable way to measure things, okay, I would suggest for you to just use things on treadmill, because it's easy to get, or else W level water or accelerometer is not easy to get, right? So yeah, against that, with anything that you can measure, and then draw a graph. Okay, same principle. Draw a graph. It can be like this, or the other way around. But the R value, okay, the R value need to reach, okay, the R value need to reach of at least, okay, at least 0.8. Okay, the slope need to reach at least 0.8 in order for you to classify that test is valid. Okay, that test says the test actually measure for that particular activity. Okay, is the thing that measure the physical activity. Okay, so that's actually the tool that is validated. Okay, so R equal sorry, this is less, right? Sorry, more than. It's more than. It's more or equal to. More equal to 0.8. Okay, more equal to 0.8. So make sure you have R value more than that to consider that method is reliable. Okay, so yeah, I would rather say that 0.8 or negative 0.8, depending on your method. So I would say just negative 0.8. 0.8. Okay, or negative 0.8. Okay, if the graph is this way. Okay, let's say the graph is like this, negatively correlated. So yeah, get the new test validated first. So that could be one of the way. And to test the reliability, test reliability, meaning that if you want to test whether the new method is precise or accurate, is for you also to do same principle like this. This is what we call correlation test, or to test the validity. You can also use correlation as well to test the validity, but you have to measure two measurements of a group of people or group of population to achieve a certain degree of R0 value of also more or equal to 0.8. For example, yeah, let's just get rid of this first, yeah. All right. And okay, okay. All right. So okay, test your device or new tools twice. Okay, at standard or control condition. Okay, test one, and then test two. For example, it could be questionnaire. For example, you are you know, you are creating a questionnaire, and that questionnaire will provide you certain scores. You give the questionnaire to your subjects or your clients, and they will respond accordingly. And then those clients will answer, okay, the questionnaires 2 times. Okay, the first test, you retrieve all the results, and then after a couple of weeks, you also give them again, okay, same treatment, same situation. You give them the same questionnaire and see whether, okay, the plot will give you, okay, the plot will give you a positive correlation. Okay, okay, this is the number of subjects. Okay, okay, result, you plotted it, test 1, test 2 against test 1, test 2. Okay, 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 and then yeah, of course, the more you get participant or respondent, the more accurate or the more reliable data will be. Okay, okay, and then yeah, test 1 against test 2, and then you have this data. Of course, you can draw a graph, a correlation graph from here, and if the R value achieved is more or equivalent to 0.8, that means your test is reliable. Okay. So that's the way how you can you have to test the reliability and validity of both of your validity and reliability of your new test in order for you to monitor your client's physical activity. So do it in a scientific manner, okay, so that you can prescribe it accordingly. Okay. All right, so yeah, that's that. So test the validity and reliability first. Okay, make sure it's valid and reliable. So yeah, so criterion validity is the method that I mentioned just now, doing the correlation test and lies or against it with other established validated methods. Okay, new methods validate against the new method against the already validated methods. Okay, so that's that. Now let's move to relative and absolute physical activity, physical activity intensity. Also, in exercise, when you do it on your clients, these are the absolute variables, which are speeds, resistance, okay, number of weights, okay, and then also metabolic equivalent, okay, or in METs, and also heart rate. If you want to do it to the special population or for those who have a high potential to get injuries, you must do it in the manner of relative. Okay, you must make it in percentage. or do it in a sub-maximal way or relative to their body weight. If they are obese, of course, you have to relative to their body weight, because different body weights will end up having a different intensity, different difficulty. Okay, so that's the relative and absolute. And I'm also going to explain you of certain fitness and how to do a relative measurement or prescription, okay, to your clients, okay, based on different fitness type or fitness mode. So the first is aerobic exercise. So aerobic exercise is can be described as the percentage or volume of oxygen consumption. And all of us know that aerobic exercise is very much correlates with heart rate, okay, rating perceived session, okay, the difficulty, the perceptual thoughts that exercise difficulty level, what is, okay, and then blood pressure, okay, higher aerobic activity will of course produce higher blood pressure. Blood lactate, okay, high intensity will produce more blood lactate. And of course, electrocardiogram, okay, the electrocardiogram is very much related to heart rate as well. And special population may have a certain clinical perturbation or comorbidities and may not meet criterion to perform a maximal measurement, okay, because of their, for example, diabetic population will have difficulties in compensating with high intensity exercise, okay, because they are rarely or difficult to reach to their maximum heart rate, okay. So it's it's impossible for you guys to measure their VO2 max, of course. So hence you must use approach of a submaximal exercise, okay, to monitor or to observe to obtain their maximum based on their submaximal methods. And of course, you must use the method of VO2 reserve in prescribing their exercise intensity. I'm going to explain this later, but first I'm going to explain you how to, for you guys to first measure their VO2 max based on the submaximal methods. I know maybe you guys have learned this already in your previous courses. I think it must be exercise physiology 1 and 2. Okay, how to measure submaximal VO2 max based on the graph extrapolation. But it's okay. I'm going to also make some revision for you guys to just refresh back what you have learned. And then after you have reached the after you have obtained the predicted VO2 maximum, okay, then you can measure your client's VO2 reserve, okay. Based on the VO2 reserve, you can prescribe the I would say the intensity of your clients, okay. I'm going to explain that as well. so and also I'm going to explain you the difference between VO2 reserve and also VO2 max. What are the difference? Why VO2 reserve is actually the best way for you to do exercise on your special population compared to VO2 max itself, by just using the percentage from VO2 max, okay. might as well you just use the percentage from VO2 reserve. Okay, I'm going to explain to you on that, okay, on my next lecture. So yeah.